everybody. It's the Radio Surgery Show with Dr. Gil Lederman, M.D., New York's only Harvard-trained, triple-board certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone in the heart of New York City. And now, please welcome Dr. Lederman.
Thanks, Rob. And yes, this is Dr. Lederman, and we're here together to learn, to be smarter, so you can avoid a lot of the pitfalls and calamities that befall so many people who get cancer care in New York and in the area and in the country and actually around the world. We have patients from more than 100 countries who have visited us for treatment, and they come for one reason. Everyone comes for one reason, and that is to get better. This is the only show in the world where you have a behind-the-scenes view of what's happening to people with cancer. And it's like you're on rounds, like you remember Marcus Welby or Dr. Kildare. They go on rounds and talk about the patients. Well, you can be on rounds, and you can learn about all of the patients and everything. Well, you won't learn their names, but you'll learn everything else. You'll learn what happened to them and more or less where they went and how they've been treated and what's happened. And we're here to analyze what happened to try to get better treatment for people with cancer, better chance to learn all the options for people with cancer, whether it's a lump in the breast, a breast cancer, prostate cancer, head and neck cancer, lung cancer, liver, or pancreas, or bladder, or kidney cancer, or melanoma, sarcoma, more. This is the work we do. Educate. That's the only reason we're here. So we're going to jump right in. I'm going to introduce myself in a few minutes, but I'll tell you I'm a board-certified cancer doctor practicing in New York for more than 30 years, trained at Harvard Medical School. My name is Dr. Gil Lederman, working at 1384 Broadway. I want to tell you about a 69-year-old woman. She had one son, and she came with a history of COPD. She went to doctors at the biggest hospitals in New York. She has COPD, which is chronic obstructive lung disease, or emphysema. She had a nodule in the lung. They tried to do a biopsy at the super-duper big hospitals. And her doctors wanted to have surgery to remove part of her left lung. And she was worked up. And she had a CT scan. She had a lesion that was 13 by 13 by 16 millimeters. It was new. She had prior CTs of the chest that was never there. She had scarring in the lung. She had fibrosis. She has emphysema. She has COPD. She had a PET scan, and a CAT scan looks at pictures of, is more or less a photograph of the body. A PET scan does that, and it injects radioactive sugar. Cancer likes to eat. It will eat anything. Sometimes people think it only eats sugar. That's wrong. It eats anything it wants. But sugar is something that's easily labeled, so you can put a radioactive material on it and follow it and take pictures and